So, a question that comes to mind when chemotherapy starts is, what is this chemotherapy all about? How will it be given? What is the meaning of cycles in chemotherapy? And do they really need to be given exactly at on time, or can there be delays in chemotherapy? So, chemotherapy is many drugs which are put together and then we call them as combination chemotherapies. Most commonly, we use a combination called ABVD for Hodgkin's lymphoma, and we use something called as CHOP-R for non-Hodgkin's lymphomas. These drugs are given either every 15 days and or every 21 days. If it is given every 21 days for 3 to 4 times, it is called 3 to 4 cycles of chemotherapy for non-Hodgkin's lymphomas. In Hodgkin's lymphoma, we give the medication every 15 days. And so every month we give 2 injections of chemotherapy. These 2 injections together form one cycle in Hodgkin's lymphoma. And the decision about giving 2, 4, or 6 cycles depends on the stage of Hodgkin's lymphoma. And similarly, the decision about giving 3 weekly 6 cycles of chemotherapy for non Hodgkin's lymphoma also depends on the stage, and sometimes we are able to reduce it to about 4 cycles for patients who have early stage disease. So once chemotherapy starts, there are many thoughts which come into our mind about the side effects of chemotherapy. By and large, these side effects are kind of divided between what will happen to you immediately when the chemotherapy starts, what happens in a few days from the time chemotherapy has been given, and what will happen in the long run, that is the late side effects of chemotherapy. So, if we look at the immediate side effects of chemotherapy, it starts almost as soon as the chemotherapy is started. And initially, it may just be a painful feeling in the vein in which the chemotherapy is being given. If this is not taken care of, sometimes the chemotherapy may spill into the surrounding tissues, which is called as extravasation. And by and large, the doctors and the nursing staff take care that such a thing doesn't happen when a patient is getting chemotherapy. Immediately after that, it is nausea, vomiting, and a little bit of tiredness which the patient feels. In the next 2 to 3 days, there is absolutely no appetite or no taste for the patient, and they must actually consider taking food and oral fluids forcibly so that they don't lose their stamina. Because if they don't eat in the few days that follows, they will be more fatigued and they will feel a complete loss of stamina to do any of their own jobs. As chemotherapy goes in, we know that the drugs act not only on the malignant cells, but they also have an action on all the other systems in our body. So, gradually, the mucosal cover in the mouth starts getting a little raw, and patients feel a rawness in the mouth, which also may lead to painful ulcers in the mouth if good oral hygiene is not maintained. As blood counts come down because of chemotherapy, patients get more and more prone to infections and may come with fever, loose motions, mouth ulcers, as I have already mentioned, or may get respiratory tract infection and start coughing and bring out mucoid or sputum which is colored. These are all signs of infections which happens when the counts are low, and special care needs to be taken of these patients during chemotherapy so that these infections don't spread into the body and cause long term damage to any of the organs or sepsis in a rare patient. Once the counts begin to come up, most of these things settle down and the patient is ready for the next dose of chemotherapy. As the cycles get over, some of these side effects actually increase towards the later part, which is towards the fourth and the fifth and the sixth cycle. And in some patients, the side effects become troublesome, and the doctors have to actually decrease the doses of chemotherapy, which they do according to the patient's ability to tolerate the doses. What is important is to maintain the doses of chemotherapy as close to the recommended doses, because this is one of the most important factors in taking these patients to response to therapy and later on giving them the best chance for cure. And so it is hard to say, but sometimes it is better to be able to bear some of these side effects in discussions with your doctor rather than to run away from chemotherapy or delay the next chemotherapies, because the results also get less as we delay chemotherapies. Post chemotherapy, when we finish therapies, patients are prone to infections, for which there are ways that the doctors take care of these infections. And most importantly, for young patients, we worry about fertility, sterility, and the long term impact of some of these drugs on the heart and the lungs.
So see, the way I generally had my channel done in the left hand, because left hand vein was better than the right, so my right hand was free. I used to have I can use my phone. I used to eat my own food used to come from the home. My sisters tried to feed me. I said, why? My hand is free, why should you feed me? I will have my own food. After my third chemo, the hair started falling in such a way that I had to shave my head. So, yeah. So one thing I must tell all the lymphoma, those that are attacked by the lymphoma, lymphoma is actually a disease which is 100% curable, which I now absolutely believe. And two, three things I want to give them a tip, that they should have a confidence on their doctor. They must tell the doctor everything about their health, what they are feeling, and keep themselves cheerful and busy. If you start thinking about your disease, then it's a problem. I never used to think about my disease. I totally forgotten about my disease because I was working. That's the best way to overcome this kind of problem.